Yeah, it's your girl Lex, of course, checking in with the hottest podcast, Bossing Up with Lex in the city. And of course, today I got a very special guest for you guys, a very special guest. And we're going to talk about some very important questions and information that you guys would like to know and get informed of course. And I come to you to give you guys the one and only, the hottest topic and the most educational topics. Of course, I got Nurse Tay in the building.
What's up, y'all?
And this is Tay. She's Nurse Tay, Nurse to Beauty, of course. So make sure you follow her, guys.
What's up, y'all? My name is Tay. I am a registered nurse and a certified manual lymphatic drainage therapist. I reside here in Atlanta, Georgia, and I service the Atlanta area and surrounding metro counties. I provide post-operative care for all cosmetic surgeries, and I also offer body sculpt and body contouring services for ones who don't want to or qualify for surgery.
Yep, that's right. So I got the nurse in the building for you guys, and she is a RN, a registered nurse. She's not no CNA, and I don't knock any of those CNA medical assistants because everybody, hey, we get money in Atlanta. Everywhere we get money, but she is a registered nurse. With that being said, she is our RN. Okay, so what we're going to talk about today's topic is, safety of surgeries, the pre and post-op, which is all very, very, very important when you're choosing, the right surgery to have, the right doctor, the right information that you guys need to know. So give them a little insight about you, and what do you guys have to, educate my girls on with surgery? Because it's summertime. Everybody's getting their bodies done. Everybody want to look right. They want to look fit. So, give them a little education about it.
Right. So a little bit about me is I am a registered nurse. My background is ER. So I've been an ER nurse for 10 years. I've also did travel nursing. When COVID came, I was one of the ones that went to New York. And I went to Texas and California, and I was pretty much gone that whole COVID year. I had cosmetic surgery myself, which is how the business started. I had Lipo 360. And during my journey with it, there were so many things that I didn't know, so many supplies that I didn't have, so many tricks that I needed to understand to make sure I have, a smooth, easy process and transition during my recovery. And my first thought was, man, if I'm a whole nurse and I didn't know I was supposed to have this, do this, know this, right, then what about the average client who doesn't have a medical background? I'm pretty sure she or he is in the same boat, looking real crazy. So I started doing more research, seeing how many nurses were actually active in a post-operative care business. And at the time, it wasn't that many. So I was like, maybe this is something I really should do. So I got the proper training that I needed, and then I started the business.
Oh, wow. That's great. That's very interesting, which is very, very important. Myself, I love to eat. If you guys follow me, of course, you guys do definitely follow me on my Instagrams, my Facebook, my TikToks. You see, I'm always eating. I'm always, into food. Food, of course, got me to gaining so much weight. I done had lipo 3 times, and they always say a third time's the charm. But anyways, with that being said, I'm not doing surgery anymore.
Okay.
So since I'm not doing surgery anymore, I hear the girls now are getting this weight loss shot. What do you, as a nurse, a registered nurse, with that being said, what do you guys, what do you think about the weight loss shot? Is it good? Is it bad? Educate
absolutely.
us.
So there's so many weight loss supplements and things to do these days. I will say the most popular thing, which are the lipo shots, the weight loss shots, they are an amazing asset to you as a service for weight loss if that's what you choose to do. However, everything needs to be controlled within good reason. So as long as the person who is prescribing it to you is a medical professional, they understand the side effects of what it can be. They understand if you actually can benefit from it, because keep in mind, it's actually meant for a certain type of medical condition, which is diabetes. However, just because that is the case, it doesn't mean that you still can't lose weight from it, because that's what it's for. It's to help them actually lose weight and control their blood sugar. Right. So naturally, when they start taking it, they're going to lose weight. And then they realize, oh, wait a minute, it really makes everybody lose weight. So right. That's how things are started when prescribing it. So as long as your medical professional understands what your goals are, what you want to get to, that it's healthy for you to take, there's nothing wrong with doing any of those weight loss supplements.
Oh wow, that's very informative. Of course, you guys listening and tuned into that. That's very informative for me myself to know because I'm always trying to dip into that or this or that and trying to figure out what I need to do to lose some weight so I can get back into my old clothes because I got a lot of clothes I need to fit in.
We all do shit.
Exactly. So, um, since surgery is very hot, very popular, of course, with the recent death of Miss Jacky O, R.I.P.
Yes,
We send our condolences to her. What complications do you think, as a registered nurse, would possibly cause, what had happened in that situation?
Okay, so the main complications that can happen immediately after surgery, which is a critical window, which is between, we'll say 24 to 72 hours once you're post-op. So from the first to third day, the main things that one has to take into consideration is their breathing. That's the most important. As we know, when you do have cosmetic surgery, if you choose an option to go up under anesthesia, that is something that you definitely have to be aware of. You need to make sure that you feel like it is time for you to be discharged from the recovery center. Sometimes if that means speaking up and saying, hey, I don't know, I think I'm still kind of drowsy, I can't really get around, can you give me a second? Ask for that. You have to advocate for yourself. So one of the main things that could have happened was too much anesthesia post-operatively and then being sent home, without it being the proper amount of time. The other main complications that clients have, which could cause death, is a blood clot, which is what we call a pulmonary embolism. It can get trapped within your lungs or within a vital area in your cardiovascular system or your respiratory system, and it could block an airway. And a lot of times that happens well, which is why please, please, please take your Lovenox shots. Take your blood thinners that you are prescribed to take. They're there for a reason. The rules are in place for a reason. Okay, so those are the top one. And the third one is a fat embolus. That's from the BBL client. So so that's why it's so important to not sit on your butt and do all those extra things because that fat is so loose at first. Even though you feel hard like a brick, it's still loose in there. And it hasn't settled properly. So if you're doing things you shouldn't be doing, very easily a piece of fat can break off and travel to a very critical area and block an important artery.
Right. And I also hear that the BBL is one of the most dangerous.
Mm-hmm.
Is that really true?
It is true. It is true because exactly what I just said, that fat, that is loose fat that is, stirring around in that area. So when you have the requirements to not sit on your BBL for 6 to 8 weeks, it's not to punish you. It's not to make you feel like, you're going to mess anything up. It's to protect you. Wow. It's a protection more than anything. And then also remember, you're getting 2 procedures in one. So with BBL surgery, you're getting lipo because they got to take the fat. Like how they gonna move it, and then 2, you're getting it placed back into you. So that's actually 2 procedures in one. So what we call a combo surgery. Anytime you do more than one thing, you're adding more of a risk.
Wow. So that's to educate you, ladies. So anytime you're doing more than one thing, that is a risk. So make sure you choose your surgeons, your doctors, your nurses, your aftercare providers. Make sure too, after surgery, from me getting educated, of course, my first time, second time, or third time, I didn't have neither one of those, a nurse in there. Matter of fact, I might have went and got my massages maybe 2-3 times, and that was because my fiance made me get it. But massages are very, very important, and that's probably why I got these little lumps now, and I'm trying to get a little smooth in there, a little wood therapy. But anyways, with that being said, you guys want to make sure you do the right research and you get the right aftercare for your procedures, and that makes your results look really good as well, so you don't have to keep constantly getting them done over and over and over and over again. Any other tips that you have for the girls?
Yes, absolutely. So when you are wanting to choose your surgeon, more than anything, you do want to look at their background, okay? You want to make sure that they have been practicing with a reasonable amount of time, that look and see how many deaths that they have, and yes, that is public knowledge. Also, how many amount of infections that they have had post surgery as well. That's something very, very, very important to understand. And I did want to talk a little bit about what's the difference between standard plastic surgeon versus a board certified plastic surgeon. So A standard plastic surgeon, meaning they went to the accredited school for a certain amount of time, they completed a certain amount of hours, and yes, they are by law accredited and known and recognized as a surgeon. That is very well and very good, which is why some of them, once they complete that, they stop there. They don't get anything else because legally you do not need anything else once you complete those courses. When you become board certified, that means you actually sat for an exam, whether it be written or oral. And you've proven that you have not only the basic knowledge and understanding of cosmetic surgery, but you've proven that because you were able to successfully answer all the questions that were asked of you. You were able to explain, how to make sure someone is safe. It makes you more so of a reputable and a surgeon that you can trust when they do claim themselves to be board certified. And you can also look that up on their website as well, and on the Board of Plastic Surgery websites also. If they're double board certified, that means they took more than one test, which is excellent. They probably took an oral and a written exam and passed both. So that means they are more than qualified, and they definitely know what they're doing. They know what they're talking about when you are wanting to have your certain cosmetic procedure.
Amazing. Yeah, so that's some good education you guys can take in. Of course, anybody that's looking to have, I'm not against surgery at all because, like I said, I don't had it done 3 times. I still eat. I'm still fat. I'm losing a little weight now. But anyways, that's information that you can take into heed, and you can do your research so that you can be educated on who's your doctor, who's going to be your provider for your aftercare. Make sure you get your massages.
Please
and look for the right accreditations from an actual surgeon as well. A lot of us go where people with popularity go for clout. Clout is what's been, selling everything here. Lately in the media, you see people going here to get their breasts done. They're out of the country. They're in Colombia. They're in Mexico. They're everywhere. They're in Miami. Miami is one of the hottest places. I went to Miami twice for surgery. I went to Atlanta once for surgery. So with that being said, and I don't mind sharing that information with the public to let you guys know who I had surgery with and who I went and had, my 360 lipo done. Of course, all my surgery has been lipos. I never received any breast job. I need some now because you see, of course, a little fool up here. But anyways, I'm gonna try to, lose a little weight, drink a little more water so I can get smaller, of course. But anyways, I went to Miami twice. Got the 360 lipo done, and of course the weight does come back, but it doesn't usually come back in the areas that they pull from. My weight is coming from everywhere else. That's the crazy thing.
Top,
up top, I feel like a quarterback, a football player. Like I feel like a running back, wide receiver. Like I don't know what the hell. Like what's going on? Like,
and that's the biggest misconception.
I found myself couldn't get in jackets anymore. Couldn't fit in my blazers. I couldn't fit in my cute outfits. Like I'm like, what is really going on? You know what I'm saying? So the weight doesn't come back in the places that they take it from. It coming everywhere else that's unwanted. So it finds yourself wanting even more surgery. With that being said, I started to realize you gotta love yourself for how you are. At the end of the day, a lot of people say working out is a good thing, eating right. I definitely say the last few weeks, me trying the route of eating right has been amazing. Like me eating salads, me eating like seafood, me staying off the fried chicken, because usually I go to Popeyes and get like a 3-4 piece with a pepper, like hot sauce. I get red beans and rice mashes. I don't know when to stop choosing my sides, because like when I see food, I tend to like seafood. Like I just want everything. You get what I'm saying? So I don't know when to stop choosing. And then everybody sees me. Like I'm always eating at 5-star restaurants, fine dining. So I like to eat. So you being able to control your food, that's very important as well. Like of what you eat, what you take in as well. And try to work out with it. Even if you don't want to see yourself going to the gym. Someone I spoke to the other day, which works out all the time, was telling me you don't even have to do that much, Lexus, of working out. All you have to do is a little bit of walking. So I said, walk where? Walk around the block? They was like, no, you need to at least walk a mile. I said, I attempt to try, but me walking a mile, child, I can walk a block over, but that's about it.
Most say it's 70% what you eat, 30% actually working out. Like, you can change so much with just changing your diet alone. And surgery is a lifestyle change. It's not a microwave fix the problem. Like, you still have to work to keep up and maintain your investment. Like, you don't just wake up and you snatch falling off the table. As the biggest thing that I hear from clients as far as, complaining and things like that, is that the main thing they say is, nobody told me about this part, which is the aftercare. The only thing that they're focused on is the before and the after. They don't talk about that middle. And the middle is a process.
Right.
It's a process. You have to get your massages. You have to eat correctly. You have to make sure you're taking all the medications that are prescribed to you, especially if you were given antibiotics. Please finish those. You got to follow all the and stay motivated, because it's not gonna look how you want it to look when you first wake up. I remember when I had my surgery, she pulled the garment down. I'm looking down, looking at her, looking down, like what's up? That's not what I thought it was gonna be.
Right.
And she was like, oh no, you're gonna look so beautiful. So I'm like, well, I don't see it right now. You have to work to that. You got to get those results, and the most you put in to your aftercare the first 3 months, that is the best time to do literally everything that you can. Go as hard as you can and be consistent with your massages, because that is when your skin is the most moldable. And a lot of people don't know that. We can really make some changes and start that mold and contour of that new hourglass figure that the surgeon gave you. But we're working against time. So we got to get you right within a certain amount of time.
Right. I'm a firm believer of the fast method. Like, a lot of us want everything that comes fast, and I speak about this when I mentor, when I market, when I brand, when I advertise. Anything that comes fast don't last. So if you expecting fast results from a surgery and think that, okay, I just had this body done and this is all this is all I gotta do, it's not gonna last. You got to be able to maintain it and keep it up. And I'm a perfect person, because 3 surgeries, after that, I'm not going back no more. I tell people all the time, I got my man. He been there 10 years, baby. He ain't going nowhere. Yeah. You know what's up, baby. He's not going nowhere. So he been there 10 years. So you gonna either take me how I am, or
they get frustrated about the garment, because if you want best results, you got to wear your garment for 6 months to a year.
That thing be hot. That garment,
yes, it
so
does.
hot.
Summertime is not a good idea to have surgery, and that's why it's everything's at a discounted rate, because everybody knows that. Well, we know that, who know better.
Exactly.
But the ones who book the surgery, they find out. But then it's too late, because you didn't have the surgery. Like, you should have waited till the wintertime when it's cool, and it's okay to have on the phones, the board, the undershirt, the garment, and all of that stuff.
I got a good question. The crazy question is so many people, like, I'm scrolling down my timeline, my Instagram, my TikToks, Facebook, and I'm looking like a lot of people are doing aftercare for surgery, but, I wonder, like, how do you know if they're licensed? How do you know if they're doing the massages in the correct way? Like the wood therapy, what recommendation would you say, for them when they're doing these procedures? Like, because everybody, tends to hop on the next bandwagon. They see this person over here doing this, and she's on tour training these people. Oh, let me go take this class. And next week you're doing the procedures and you're teaching people the following week. And you don't have enough credentials for that. Correct. Which I always say, don't ever stay at a level in life to where I'm here and I don't expect nobody to get here. Because in life, you're meant to elevate. Right. Elevation comes with separation. So you got to start separating yourself from people, places, and things, in order for you to get to that next level. So with that being said, a lot of people that I see train with others, they start training and doing the procedures right away, and they don't get the actual hands-on that they need. You know what I'm saying? What if someone that just had a whole BBL or a whole mummy makeover, which is really invasive from my understanding, that's 3 procedures?
Yeah, about 2 or 3 in one.
That's a lot on the human body, and even as women, as us birthing a child, that's a lot on us as well. So that's another thing. We need to be educated on how long do we wait before we get surgery after we have a child. How long do we supposed to wait? Like, okay, that's a great question.
Thank you for asking that question. That is a really good one. So rule of thumb is you need to wait minimum 1 year after childbirth before you consider having a cosmetic procedure. Okay, so let's say you had 1 cosmetic procedure and you think you want to have another one. You have to wait minimum 6 months. I still recommend a year, but at least wait 6 months to see what that cosmetic surgery procedure did. If you like your results, it's too soon in the beginning to be saying, oh, I don't like it, I think I need to do more. Wait until you can see your final results first before you start adding on additional things that you want to do. And as far as training, of course, if you go on someone's platform, they should be telling you what all type of qualification that they have, and they should be able to provide proof. I don't have a problem showing anyone any of my certifications because I know I have them.
Right.
Okay. The ones who will get an attitude about that, well, maybe that's a red flag right there. I'm not gonna
Right.
mind you asking me to show you. I got them, boo, here, boom. Like,
Right.
are you gonna book or what? I'm not like I'm confident in what I do. I know that I know what I'm doing. Also, you asked how many clients have you maintained, or are you familiar with this type of surgery? I've had clients before booking. I said, I just want to know, have you had someone that had this going on or that going on? Absolutely, I have. Or I'll tell the truth. Actually, I have not experienced anyone with that as of yet, but I still am a registered nurse. Maybe I can answer a question if you have, and if you thinking you might have some sort of complication that you need to follow up and see with the provider for. So just to always tell the truth, please don't. When you learn how to do something like this, because I teach as well, I do teach people how to provide proper and safe postoperative care. But I also tell them that you need to understand what you're doing. You need to make sure you're confident in what you're doing. You need to make sure you can answer these questions. Clients have a lot of questions. Lot of questions, like a lot of questions. All day long, I'm getting asked questions. You want to be the expert. You want them to make you feel like you're an expert. There should not be one question that they ask you, even if you don't know the answer, you may know something around that can still bring you to the answer. So a lot of times the clients want to feel safe. They want to feel like I can trust you. I know for a fact some clients have told me, like, I booked you because I saw you was a nurse. I know you know what you're doing. I know I'm gonna be okay. And that makes me feel good. So, and it's okay if you're not a nurse doing postoperative care. So I don't want to dig or diss or anyone who doesn't have that. What I will say is it is in your best interest to have someone that has a medical background, because I look at you as a patient, not just a client. Right. Especially when you're fresh post-op, because you just had surgery. Mm-hmm. And in the medical world, cosmetic surgery is defined as a minor trauma. So you just had trauma done to your body. You should want someone that knows how to maintain and handle a trauma to have eyes on you when you're first post-op, which is me.
RN, registered nurse, because baby, if I have anything else done, which, like I said, I haven't on my life, but I do need to get these this weight here. Stop making me feel like I'm quarterback taking off here. So of course, I'm interested now into doing a breast reduction, which I have a lot of back problems and things like that. And I'm getting, a breast reduction because that's what's causing a lot of the back pain. So what advice would you give me in doing reduction, for the breast? Like what could you give me?
The main thing is when you're looking for your surgery for a breast, pay attention to their scar line. That's something very important. It's something that you're going to, want to take in consideration with how you look. You want to make sure it's nice, clean, and even, like a clean incision line. Also, along with that, what are your goals? How small do you want to get to?
Girl, I want to be bald-headed. When I say bald-headed,
never heard somebody want to be bald-headed in their chest. Like, come on now.
You want a little bald-head? I want to be bald-headed because obviously I can't stop eating. So since I can't stop eating, I need to be bald-headed. But like for real though, when I did go to the consultation, like I was telling them, honestly, put me at an A. And he was like, come on, be realistically. Okay, I accept a B, but that's it. That's as far as I go to a B, because I honestly see the more you eat, the more you actually do gain in your breast area. And people gain weights in different areas, but as I watch myself over the years in my body, I'm gaining weights more so in my arms, my breast area, my stomach area. So with that being said, I would rather be at a lower letter than a higher, letter of, doing the breast. So that's why I said make me bald headed.
Just make sure you find someone who actually does, someone who has breasts that's similar to your size and took it to the size you want to go. Right. A lot of times clients, like you said, they'll follow the wave, but that client may have snatched her, but he's not going to do that on you because y'all are two different body types.
Exactly.
So you gotta do your research and go by the body type of that type of surgeon. Let's just be real about it. Every surgeon is not good at everything. Okay. A lot of them are targeted and focused on one particular procedure they do really, really well. That's what you want to find. So you find a really good doctor who mainly does breast surgeries. And that's what you focus on with your research. If you are 120 pounds, why are you going to someone that specializes in plus size women? Your results are going to be different. So a lot of times that's a mistake that some clients make, is not choosing the right surgeon based off popularity and not actually focusing on you. Worry about you, stay in your lane and what your targeted goals and results are.
Great. That's Very informative information. Now, another thing, what as a person that's getting into the surgery or post-op or pre, you're getting into that industry, what marketing and advice could you tell them if they want to get started as a surgery advisor? Because there's so many centers that I see now that are advisors that are recommending you to go here, recommend you go there, or recovery houses that want you to come here, but they don't have this qualification, they don't have this. That's why a lot of them I heard in Miami are getting shut down because what's required is not there. So what recommendations or information can you give the audience, or I guess,
Correct. So when you're looking for a post-operative person, it is advised that you do look for someone that, yes, does have somewhat of a medical background. Along with that, how long have they been in business, their Google reviews, surgery groups. Facebook will tell it all. Every single surgeon has their own Facebook group. They may not be running it, but they definitely have their name attached to a surgery group. You can find out whatever you want to know in those groups. The clients don't lie. They have receipts. They have pictures of their work. They have text messages from the surgery center. They got recorded conversations to prove that, hey, this surgeon did good by me, or hey, y'all might want to pay attention to this one because this is how I was done. Right. So definitely do your research in the groups. Along with that, when you're also looking for a post-op person, like I said, ask to see, or do you have proof to show that you are a nurse or that you are a CNA? Because if you're going to have a recovery house, you do need to have a medical person there by standby, because things happen. Things happen during aftercare. You want to make sure that someone actually knows what the signs of an emergency is. Sometimes people will get brushed off, or they'll be like, oh, that's fine, let's give it a couple of days. No, you need to know someone who knows what an emergency looks like, even if it doesn't present as such to you. There's been plenty of times I've had to tell clients, I don't care what they told you, I'm telling you that you need to go to the ER right now. One actually had sent me a message back thanking me because she was like, had I waited 24 more hours, I would have lost my nipple, because I was told that everything was okay.
I know nobody want a bald-headed nipple.
Well, that's what
But the crazy thing is, guess what? I do 3D areola reconstruction, so I can create you a new nipple. But I want a bald-headed nipple. That being said, because can you imagine you meet somebody and you get home and you taking off your bra and you got one reindeer and the other one down? Like, what the hell you got going on? So anyway,
you might want to fix that. You might want to fix that.
Also, another question that, I know a lot of people want to know is, how lucrative is it? Is it a lot of money? Is it a little bit of money? Because right now, everybody know we're going through a economic recession, a setback. So I explained to a lot of people call me all the time for mentor advice, how to revamp their website, how to revamp their platform, how to revamp their brand. And I tell them, you have to stay in there. You have to push through. You have to trust the process through it all. And you can't give up. A lot of people are giving up right now because things are not coming in as fast as they was years ago. Right. And with that being said, you got to realize the economy years ago was a lot of money flowing in. Right now, you got inflation at its all-time high. So you can't get as much as you was 2-3 years ago that you are getting now. So with that being said, I like to tell a lot of my girls, you got to trust the process and you can't give up on yourself. A lot of people like to give up on themselves and, oh, I got to find out something else to get into. I got to find a new industry to get into. Why? Why do you want to do that? Why you can't trust the process? Why you can't stay down? Why you can't stay motivated? Why you can't believe in you? Because if you believe in you, once you, all the time, I stand in the mirror and I look at myself and I be like, you can do this. You can achieve this. I speak life into anything that happens with me, my business, my family, my health, my finances. I speak life into it. So that I tell a lot of my girls that I mentor all the time, the tongue is powerful. When you start speaking negativity, that negative energy start rubbing off from here to here to here to here. So when you start speaking that, you receive that. When you start speaking life into your businesses, into your health, into your household, to your finances, you receive that. So with that being said, how lucrative, how much money these girls can make with being in this industry to keep them inspired and keep them motivated, because of course people are not making a bunch of money doing surgeries now because a lot of money is not flowing through the economy right now. Mm-hmm. But Is the economy going to stay down forever? Of course not. It's not going to rain forever. Right. And when it does lighten back up, the sun's going to come out. And when that sun comes out, you got to go and you got to keep running. You got to keep pushing, and you got to keep, striving to be the best you can. So how much money is it in the...
It can be very, very lucrative, because keep in mind, this is not a once a month type of massage thing. No, your client is getting massages every day or every other day.
Oh, wow.
So what I tell people is, in this business, you don't need a lot of clients. You need loyal clients, which are ones who will care about their results. Because if they care about their
a word, not a lot of clients, loyal clients.
Okay, ones who care about their results and trust you, because they're gonna be paying for packages back to back to back. That's why I said the first 3 months are the most critical, because you got to get it all in. Now keep in mind, still do things after that, but you get a client who really wants to protect their investment, meaning they want their surgery like they actually had surgery and they come good, they're definitely going to spend what needs to be spent. Also, what I tell people, when you take certain courses like this, you will get your investment back with one client.
Wow.
One client. I mean, when I did it, that's what happened to me. As soon as I took the course, I started training, I literally got my money back with the first client that I started with the business from the amount that I put into the business. So you can easily scale up to 10K, 20K, 30K months if you have about 7 or 8 clients. That's not hard to get. You just have to be a trustworthy person. You got to push yourself and be out there more than the public. You can't even maintain a lot of clients like that every day if each one needs massages every day.
Exactly, right. Wow. That's very informative information. So, guys, always know when it rains, it may pour, but eventually that sun is going to come out. So this is motivational words to you guys, to let you guys know to stick in there, do your research, get your information, stay tuned, stay intact with what you're putting into your body or who's working on your body. Also, stay motivated with what you're doing in your industry, whether it's career-wise, whether it's something you may be switching career bases and you're going into another industry and you're trying to figure out, okay, is this really lucrative? This is my motivational podcast to come on to inspire other entrepreneurs, to let them know, like, okay, I have Nurse to Beauty on here. She's letting you know this is a very lucrative industry, and you want loyal clients over a lot of clients, because it's not about the quantity at the end of the day. It's about the quality that you're giving your clients. So with that being said, stay in there, stay motivated, stay tuned, and of course, stay bossing up with Lex. And this is our guest today, Nurse to Beauty, and hey, we're out of here.